Hey, what's up, guys? So, today we're gonna study principles of antimicrobial therapy, pharmacology. The topic is a bit long, so we'll divide this topic into 4 days, okay? So, first of all, I'd like you to see these notes. We'll cover this topic, principles of antimicrobial therapy, which comes in unit chemotherapeutic drug, a topic of pharmacology. We'll cover this in 4 days. I'll divide this I'll divide this topic into 4 days. Okay, first of all, what do we need to know? First of all, in pharmacology, to have a good preparation for your exams, what skill do you need? What do you need? First of all, what you need is commitment with yourself to memorize things, to learn, to have motivation for this because this is a really interesting subject. Okay, so first of all, what is the purpose of taking antimicrobial drugs? Simple. Treatment of infections. Learn what are the learning objectives from this chapter? The chapter Principles of Antimicrobial Therapy. The learning objectives are selection of antimicrobial agent, number one, like these are the subtopics, and we'll divide these subtopics into further subtopics, and we'll study, we'll learn, we'll memorize the other the content which will come under these subtopics. So the subtopic we're gonna cover today is only gonna be selection of antimicrobial agent. First of all, I'd like you to know the main learning objectives, the main topics from this chapter that we need to study in detail. Selection of antimicrobial agent, routes of administration of these antimicrobial drugs, rational dosing of these drugs, chemotherapeutic spectra, combination of antimicrobial drugs, drug resistance, complications, sites of antimicrobial action. So, first of all, we'll study selection of antimicrobial agents and what are these dependent on. The selection of antimicrobial drugs or antimicrobial agents that we need to select, we need for the cure of a disease are dependent upon, first of all, identification of infecting organism. Secondly, empiric therapy. Don't worry about what's empiric therapy. I'll explain empiric therapy in my next lecture, in my next video. First of all, you need to understand the basics of this chapter, or otherwise you'll get confused. So we'll study, I've told you in the start of this video that we'll divide this chapter into 4 days, so we have no hurry to learn this because we want to learn it smart way and effectively, and we need to memorize things also, and this will take time, so don't be in a rush. And so the third factor is antimicrobial susceptibility of organisms. Like, okay, what is this? This is basically that what are the, for example, there is an antimicrobial drug, say, and there is an organism. So that organism or that bacteria is in danger from what drug? We need to know that. Like in a game, I would say Call of Duty Black Ops, there are certain zombies which are in danger from those gunfighters or whatever. So basically, for example, you can say that bacteria A is in danger from drug X. Okay, so this particular bacteria A is in danger from drug X. Same if we say bacteria B. Bacteria B will be in danger from drug Y, or it can be also case that the drug X attacks both bacteria A and bacteria B. So basically, what we need to learn from this point is that what organisms, what drugs will be effective against a certain type of organism. Okay, so the fourth point is the site of infection in the body. We'll decide the drug based upon the site of infection in the body, whether it is the limbs or head or neck or lower limbs or central part, abdominal part. It is dependent upon the site also. Patient factors like if in case of men, are the men diabetic, or do they have the problem of high blood pressure or other diseases. In case of women, we need to consider that are the women pregnant, or are they breastfeeding, or certain kind of diseases do they have, like diabetes. We have to check that. We have to check these factors before prescribing a drug to a patient. Okay, the sixth point is the safety of the drugs. The safety, okay, we can say safety like some kind of drugs, they do have side effects like allergic reactions, hypersensitivity, or toxicity, rashes. Okay, these are the side effects. We have to check that certain or a particular amount of drug or dosage, is it safe to be prescribed to the patient or not. Cost of therapy, of course, we'll go for drugs which are cheaper and effective as in compared to the drugs that are costly. Okay, so guys, this was the first part of my video of pharmacology. The unit is chemotherapeutic drugs. The chapter is principles of antimicrobial therapy. So guys, subscribe my channel, like my videos, share it, and I will upload the next part of this video too. Thank you guys. Take care.